Good day, sir. I'm Denise Kate Cabiedes, and I will be performing the wound cleaning and dressing checklist. So before anything else, I will check the doctor's order and will be gathering the materials that I will be needing. So here I have already prepared all the equipments that I will be using. So here I have a plastic bag. This will serve as a biohazard bag, as well as the box that contains all the sterile materials. So let's just assume that these are sterile. So here in this box, I have here the paper that is big enough to create a sterile field, and also cotton balls. Let's just assume it's sterile, and gauze, 4x4 gauze, at least 10 pieces, as well as the cleansing agent, which we will not be using it. And also I have here 2 pairs of clean gloves and a pair of surgical gloves. Now I will perform hand hygiene and ensure my patient's privacy. So for my patient's privacy, I have already closed the curtains and the doors. Good morning, ma'am. I'm Denise Kate Cabiedes, and I will be your nurse for today. So may I know your full name first? Okay, and your birthday?
December 18, 1974.
Alright, okay. So now, ma'am, I will be cleaning and dressing your wound. So basically, I will just remove the old dressing, and after that, I will assess your wound if there are any signs of infections or there are any abnormal findings that have occurred. And after that, I will be cleaning it, and then we'll be putting a new dressing. So this will aid in faster wound healing and also to prevent any complications or infections. Okay. So may I assess your pain, and can you rate your pain from 0 to 10, 0 as having no pain and 10 as having severe pain? Okay. So if with pain, I will administer analgesic 30 minutes prior to dressing change. And also, I will use proper PPE if needed. Now, ma'am, I will drape you and will be exposing your wound site. Okay. So please do not touch any of the part of your wound and also the sterile equipment that I will be using. Now I will do the removal of the old dressing. So first I will prepare a biohazard bag. I will apply clean gloves. Then I will remove the tape by pulling it parallel to the skin towards the dressing, holding down the uninjured skin. And if necessary, towards the hair growth. Then I will remove the layer of the dressing, 1 layer at a time. And I'm going to assess it. So if it drains, I will conceal it from the sight of the patient and fold the dressing to contain it. So I will not put any pressure on the draining tube, so let's just assume that there is draining tube here. And then I will now peel off my gloves and perform hand hygiene. Now for the wound assessment, I will again put on new pair of clean gloves. Then I will now assess the wound. So I'm going to assess your wound. Then I will now peel off cleaning and hygiene. Then after that, I will now do the wound cleaning and dressing. So first, I will create a sterile field. So I will place a paper. And I will be first donning my sterile gloves so that I can be able to touch the sterile equipments. Now I will be preparing the sterile field. So I will put here all that I will be using, the gauze, also the cotton balls, the microfiber cleansing agent, and the forceps. Now I will clean the wound circularly, starting from the least contaminated, which is the wound itself, to the most contaminated. So I will do this at least 3 times. Then I will blot dry the wound with a gauze. Then I will dress the wound. And I will secure it with tape. Then after that, I will be cleaning the area and I will be documenting the findings and the procedures done. So that's all. Thank you.